Hello, this is Dr. Parvez from Srinagar, and today's topic is epistaxis. And what is epistaxis? Epistaxis is bleeding from the nose, and it may be anterior, it may be posterior. We should take a good history, and history gives clues whether it is anterior, it is posterior, or 90% of the times it is from the lateral area. Age gives clues, more likely posterior in elderly, and causes of epistaxis are idiopathic, trauma, nose picking may be the most common cause sometimes, and dry mucosa may be a cause, hypertension, coagulopathy, NSAID or warfarin or tumor. And epistaxis, guys, it can be fatal, and why we need to do first aid to prevent this fatal condition from killing a person. Compression, we may do compression, we may do pinching the nose, or we may wash the nose in the ice cold water, and that may be helpful. Avoid blowing their nose when we have done the packing. Then before doing the packing they have to blow the nose, but usually after removing the packing, after before doing the packing, at the start of the bleeding, we should avoid blowing the nose. The patient should not blow the nose, and avoid hot drinks after packing is done, after treatment has been done, or during the bleeding they should avoid hot drinks and they should take cold water. And we can give nadoxin cream or naseptin cream and some local antibiotic cream which may keep the nose soft after the removal of the pack, after the treatment is done. And what we should do, we can admit. If the bleeding cannot be controlled, we may do we may go for admission in elderly. If a person is warfarinized, is on warfarin, we can admit the patient. We can admit the patient when he has low platelet count. We can admit a patient with recurrent excessive bleeding, because these people, you may discharge them and they may bleed to death. And primary care may do something about regarding it before referring to the tertiary care. If it is not settling with conservative treatment, we can refer to tertiary care from primary care. Silver nitrate cautery can be done in general practice, outside in the primary health center, in the general practice in the rural areas. They can take a silver nitrate stick and they may do cauterize the area, visualize the area and then cauterize the area. Packing may be done, and before putting the packing, how to make the pack should be 1 meter long, and it should be soaked in the local ointment like soframycin, or like naseptin cream or soframycin cream. Then we may do electrocautery in the tertiary care. We may do we may also do this we may also do surgery. Saphenopalatine artery, if it is posterior bleed, we may have to ligate saphenopalatine artery. We may do ligation of the external carotid artery branch, and we may go for embolization. What we need if we want to go for cautery outside the tertiary care, what we may need a good light source. We may need a nasal speculum, a large oral speculum, lignocaine with adrenaline, cotton wool, and cautery sticks like silver nitrate stick. Or if we are doing cautery in the tertiary care center, we may take the patient to the theater, and we may use unipolar cautery or bipolar cautery, and we may visualize the area and cauterize it. Thank you very much. Please like and subscribe.